Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Is Psyllium Husk an affordable weight loss alternative to Ozempic? While Psyllium Husk products like Metamucil may be more affordable than Ozempic, it may not be an equivalent alternative for weight loss. Head-to-head studies have not been done to compare these products. They have different actions in the body, and separate studies have shown greater weight loss with Ozempic. Talk to your healthcare provider before you switch from Ozempic to Psyllium Husk Fiber for weight loss or blood sugar control. What is the buzz about Ozempic and Psyllium Husk? Psyllium Husk Fiber has been referred to as the poor man's Ozempic on various social media sites. People are suggesting you might be able to achieve similar weight loss by using products like Metamucil and avoid paying the high price for Ozempic. But is this true? While fiber supplements like Metamucil may be more affordable, no direct comparisons have shown that Psyllium can lead to weight loss similar to the weight loss seen with semaglutide, the active ingredient in Ozempic, Wegovy and Rybelsus, or control blood sugars equally as well. Is Psyllium Husk more affordable than Ozempic? Psyllium Husk may be more affordable, but is not a proven alternative to Ozempic. The manufacturer of Ozempic offers a $25 copay card that can help lower your costs to $25 per prescription. Psyllium Husk cost. The powder form that is mixed with liquids to drink costs about $16 to $20 based on your retailer. Other Metamucil Psyllium fiber options include chewable wafers, about $10 per 24 count, and oral capsules, about $26 per bottle of 160 count. More affordable generic options may be available for many of these products. Ask your pharmacist. Insurance typically does not pay for over-the-counter, OTC, products. If you have an FSA, flexible spending account, or HSA, health savings account, you can pay for many OTC products with these plans. Ozempic cost. Ozempic, semaglutide, for type 2 diabetes costs around $1,029 per month for the pen injection. It is given as a weekly subcutaneous, under-the-skin, injection, but most people do not pay this price. With the Ozempic savings card you may pay as little as $25 for a 1-month prescription. There is manufacturer support from Novo Nordisk to help pay for Ozempic. A $25 copay card is available for the Ozempic injection and is available online for download. Commercially insured patients whose benefit plans cover this medicine are typically eligible. Many insurance companies will pay for Ozempic for treatment of blood sugar control in people with type 2 diabetes. It's FDA-approved use, but not for weight loss, and off-label use. Related, drugs.com Ozempic price guides, online coupons, and manufacturer's savings. Speak with your healthcare provider before you change or discontinue any prescription treatment. How do Psyllium Husk and Ozempic compare? Ozempic, semaglutide, and Psyllium fiber husk are very different medicines. Ozempic requires a doctor's visit and prescription, while Psyllium can be bought over the counter without a prescription. Ozempic is given by injection while Psyllium Husk is taken as an oral powder mixed in liquid, as a capsule or as a chewable wafer. Psyllium Husk Fiber. Psyllium Husk Fiber, often just called Psyllium, is an oral, over-the-counter, OTC, soluble fiber supplement used to help with appetite control, constipation, blood sugar control and to help lower cholesterol for heart health. A common brand name in the US is Metamucil and it's also available as a generic option. Psyllium may help you control your appetite but has not been shown to be an equivalent alternative to Ozempic to achieve significant weight loss or control blood sugars. Psyllium fiber husk products like Metamucil are bulk-forming, soluble fiber supplements used to help support appetite control, heart health by lowering cholesterol, healthy blood sugar level, digestive health, like maintaining regularity and treating or preventing constipation. You can get this supplement at pharmacies, groceries and other retailers or online merchants without a prescription. The powder form costs about $16 to $20 based on your retailer. Psyllium comes in stores as a powder you mix to drink, chewable fiber thin wafers and as capsules you swallow. It's usually taken 1 to 3 times per day, based on package instructions. Be sure to consume at least 8 ounces of fluid with each dose, and drink plenty of water throughout the day. Follow your package directions. When psyllium is combined with water, it thickens and forms a gel in the digestive tract. The gel helps to slow digestion and promotes a feeling of fullness, which may leave you feeling less hungry between meals. Psyllium is also promoted to help support healthy blood sugar levels. Metamucil forms a viscous gel that traps sugars, which are then more slowly absorbed into the body. Ozempic. Ozempic is a weekly injectable prescription medicine approved by the FDA to help control blood glucose, sugar, levels in patients with type 2 diabetes. Reduce the risk of major cardiovascular events, like a stroke or heart attack, in adults with type 2 diabetes mellitus and established cardiovascular, heart, disease. It is given as a subcutaneous, under-the-skin, injection once a week and is used in addition to diet and exercise. It is typically intended for long-term use. Ozempic is in a class of drugs called glucagon-like peptide 1, GLP-1, agonists, incretin mimetics. It works by binding to GLP-1 receptors, which results in lower blood sugar levels and A1C levels and may also reduce your appetite to help with weight loss. Ozempic's use for weight loss is off-label use, meaning a doctor may prescribe a drug for a different purpose than those formally approved by the FDA and found in the package labeling of the drug. Alternatives to Ozempic. If you are not able to afford Ozempic, or your insurance will not cover it, there may be other options your healthcare provider can prescribe that may be covered, such as Wegovy, Rybelsus or Zepbound. The active ingredient in Ozempic, known as semaglutide, is approved as a product known as Wegovy to help with weight loss maintenance in people with overweight or obesity. Rybelsus is also a semaglutide product, like Ozempic, but approved in an oral tablet form to help control blood sugar levels in people with type 2 diabetes. It may also lead to weight loss, but is not approved for this use. Zepbound, generic name, tirzepatide, a dual GIP and GLP-1 agonist similar to Wegovy, is also approved for weight loss. Related questions: what are 4 key Ozempic side effects to watch out for? Mounjaro versus Ozempic, how do they compare? How do Ozempic, Mounjaro, Wegovy, Zepbound compare for weight loss? Does Ozempic work differently than Psyllium Husk? Yes, Ozempic and Psyllium Husk have different mechanisms of action to help with appetite control. Ozempic, semaglutide, is in a class of drugs called glucagon-like peptide 1, GLP-1, agonists, incretin mimetics. It works by binding to GLP-1 receptors, which results in lower blood sugar levels and A1C levels and may also reduce your appetite to help with weight loss. It increases the production of insulin from the pancreas, reduces sugar production from the liver and slows down how quickly food passes through your body, which may make you feel full for a longer period of time. Psyllium Husk comes from the seeds of plant Argo ovata, a plant native to the Mediterranean region and also grown in Asia and North America. It is an over-the-counter, OTC, product sold at retail stores in the US and does not require a prescription. Psyllium husk fiber is a soluble fiber. It works by absorbing water in the intestine to form a gel-like consistency in the digestive tract. As the gel moves through the intestine, it helps to promote regularity, making stools easier to pass. Psyllium husk may also help you feel fuller, which may lower your intake of food. Water-soluble fibers are also found in oats, bran, beans, potatoes, apples, oranges, and grapefruit. Can psyllium, metamucil, cause weight loss? Several studies have looked at weight loss and appetite control with psyllium husk fiber products like metamucil. In a 2023 review and meta-analysis of randomized controlled studies, researchers looked at psyllium's effect on body weight, body mass index, BMI, and waist circumference in 354 participants over a mean of 5 months. From 6 studies, data showed that psyllium, mean dose of 10.8 grams per day, taken just before a meal was effective at decreasing body weight by 2.1 kilograms, 4.6 pounds. BMI was also reduced by 0.8 kilograms/m2 and waist circumference by 2.2 centimeters, 0.86 inches, in overweight and obese populations. An 8-week, randomized controlled study evaluated whether psyllium fiber improved blood sugar control and body weight in 40 people with type 2 diabetes. In the study, one group took 10.5 grams per day of psyllium with their regular diet and lifestyle, while the control group continued on their regular diet and lifestyle only. In the intervention group, body weight, body mass index, BMI, and waist circumference were significantly decreased. Weight dropped by 2.9 kilograms, 6.4 pounds, BMI dropped by 0.9 kilograms/m2 and waist circumference by 2.6 centimeters, 1 inch, all significant effects, p less than 0.001. Fasting blood sugar and A1C levels also improved significantly. One small 12-week study compared psyllium to a placebo, inactive agent, in 51 people with type 2 diabetes, T2D, and chronic constipation. The dose was 10 grams of psyllium premixed in cookies twice per day or placebo cookies for 12 weeks. The results demonstrated that taking psyllium led to a weight loss of 2 kilograms, 4.4 pounds. Positive effects were also seen for reductions in blood sugar control, A1C, cholesterol and constipation symptoms. Studies looking at psyllium fiber husk have used high doses of psyllium, greater than 10 grams per day, which may lead to intolerable digestive tract symptoms like gas, bloating or stomach pain in some patients. Adequate daily fluid intake is required to help prevent swelling of the gel or choking. The health benefits of psyllium have been shown to extend beyond weight loss and include lowering of cholesterol, blood pressure, treatment for constipation, and helping to normalize stools in patients with irritable bowel syndrome, IBS. How much weight loss occurs with Ozempic? The Ozempic brand of semaglutide is not approved for weight loss but may help you lose weight when using it to treat type 2 diabetes. 2 studies evaluated by the FDA looked at blood sugar control, A1C, with Ozempic injection given once a week in adults. Participants weighed an average of 91.8 kilograms, 202 pounds, or 99.5 kilograms, 219 pounds, at the beginning of the studies. Results from both studies showed that patients lost on average up to 6.4 kilograms, 14 pounds, although some people also gained weight. Study 1, patients using Ozempic 0.5 mg dose lost an average of 3.6 kilograms, 8 pounds, those using the 1 mg dose lost 4.5 kilograms, 10 pounds, and those taking the placebo, an inactive treatment, lost 1.4 kilograms, 3 pounds. Study 2, patients using the Ozempic 1 mg dose lost on average 5.5 kilograms, 12 pounds, and those using the 2 mg dose lost 6.4 kilograms, 14 pounds, in a study looking back at electronic health records, EHR, in 41,222 adults with overweight or obesity and treated for type 2 diabetes. 66.5% of those using semaglutide, Ozempic, lost at least 5% of their weight within 1 year. For example, if you weighed 91 kilograms, 200 pounds, at the beginning of the study, a 5% weight loss would equal 4.5 kilograms, 10 pounds. If you do not have type 2 diabetes, the Wegovy brand of semaglutide is specifically approved for weight loss, along with diet and exercise, in patients with or without type 2 diabetes. Learn more. How long does it take for Ozempic to work? The effectiveness of psyllium husk fiber or Ozempic will vary from person to person and may differ due to unique factors such as your age, weight, your other medical conditions and medicines, and your kidney or liver function. This is not all the information you need to know about these products for safe and effective use and does not take the place of your healthcare provider's directions. Review their full products information and discuss this information and any questions you have with your doctor or other healthcare provider. rxcardclub.com Get a free prescription drug card and save up to 80% on prescription drugs.